So hi everyone, today in this video we're going to develop another mental model that can be useful for you, since the mental models are always something that I've been defending in this channel, and the one that we're going to practice is the one that you already have practiced a lot. That is the mental model of putting to practice what you learn. That's where the knowledge that you have grasped during your entire life makes so you have more powers when you apply it and then so receive the benefits of applying it. But then obviously for that, what's the value of the mental model is when we integrate them in order to create a more type of resilient and efficient solution for our problems. But then, so obviously, they are useful when applied in real problems. And what's the one that we're going to focus today is the healthcare. And then, so we're going to try to fix the healthcare for 5 billion people. Obviously, it's not like a technique type of perspective to see because I'm not someone in the area. I don't have enough information. I don't have enough skill. But you can use these concepts, these models to kind of create the ideology, or so as you call so approach the problem. And so I expect to be useful if you want to hear me. And then so let's go for it. So first we need to start by understanding the problem. We understand that exists what global healthcare inequality. Some of the people have access to healthcare while others not. And we know that obviously the resources are limited. It's difficult for everyone to get fully fed with so the needs that they have to get fully fed. But probably so you can make it better the offering of our our type of need that is the healthcare. And so you have to focus by first understanding the problem and using the first principles so to understand the problem. But then so what's the problem? We have half the world that lacks access to essential healthcare. We say rightfully all world lacks access to essential healthcare. And we have 5 million deaths a year from preventable causes like diarrhea, malaria, or childbirth. And obviously, this comes with the economic cost that is so 12 trillion lost by 2030 due to poor health system. It's a problem that you have. But then, so the first principle, so help us to understand how you can start solving this type of problem by understanding what is healthcare actually for. And looks like something that's true is that health and you where you can supply it and making people having a higher probability to have healthcare. You have to focus in the phases previous so to having something and so improving treatment. You have the prevention, so how to make people get prevented better from the problems. We have the phase of treatment, the whole to make people, if they have some diseases, how to get treated. So it's where you should focus. And then so you have to start working in solutions to increasing the probability of people to get prevented from so the diseases, and as well making the treatment become better. So we have two ways to act basically, and then so you have to create solutions to get these two ways to develop. We have what generic drugs. The India's Jan Aushnabi stores sells meds at 90% discount and saved so 5 billion since 2008. So obviously make it easier the drugs that we sell, and it obviously comes as well with probably having in my handle so the costs that this type of business it tends to be a business. So everyone acts with the incentive to get profit, and also you have to have in count that to have a margin we have to control the price of where to sell and obviously the cost that we have to do to make it this type of goods. And then so obviously we have to control these type of goods probably because if they're too much expensive to get both, it's difficult so to produce something obviously, so they will as well require more for the people as a final price, which will make it something that people cannot afford to buy. And so we have to control, having so a bit more control in economics, and understanding so how this chain of production also is behaved. And obviously, so if you kind of have the majority of the countries that they have so governments that have so a bit of interference in the economy, see so how they can control the imbalance, probably by creating competition, which so may not so making the prices too much high because they know that they're competition with other ones, and then so make it more affordable for people because competition creates a higher type of building in terms of quality of the offering which so makes the people, the consumers, having a higher type of ability to have a better experience, will probably so be a way to act. In terms of the preventive focus, what do we have? We have in Rwanda's draw network delivers blood vaccines to 12 million people, cut maternal deaths by 30% by so adopting this type of incentive. So in preventing is so making it easier, it acts in making it easier the prevention. And by making easier the prevention, you're making so the process of work you just so have to give these blood vaccines people just have to take. The prevention so you can make it easier so them doing the act, not just providing the hunting, but you providing information, getting people informated and getting easier access so to information what's good for their health or not, and also make it easier the action of them. So making the action that is so active health in terms of nutrition. We have as well having a bit of exercise and controlling stress and other things. So having making it easier and having people getting incentives is what makes all the people act. That's basically what we want in terms of prevention. And obviously, so with all that, we can have a lot of different hypotheses of action, but we have the adoption of Pareto principles there. We accept that just 20% of our interventions can probably still be the ones that most impact like 80% of the consequences. And then, so for example, what do you have in terms of vaccines? 20% of interventions can prevent 80% of that, of deaths. And then, so what data seems to say is that vaccines, more clean water already prevent 70% of child deaths. So what could be solutions for that is focused in just on these two factors. Already so solve a lot of the problems. And then so we have the mosquitoes nets that are distributed 2.5 billion nets globally, and malaria deaths halved since 2000. We have the last mile health workers in Ethiopia trained 40k workers that so slashed child mortality 76-7% since 2000. Now, a bit of system thinking can be so if you want to go deep in that system and so apply more type of solutions, particularly in certain specific stakeholders action, you can look so for all the systems. So you map the healthcare life cycle. What do you have? We have the inputs like funding, drugs, trained staff. We have the outputs, healthy populations, economic growth. We have feedback loops. Disease creates poverty, that creates poor education, that creates more disease, and the cycle goes on. So we have to look at the system, we have to understand the feedbacks and the loops that we create to control so and if you want to so make it intervention to work, you have to control how and what are the elements that are going to be impacted in the chain. And so what could be potential solutions giving this more type of deep analysis, where for example Cuba's doctor diplomacy trains 30k global doctors ears that so makes bills and builds so goodwill more have the health metrics. We have the Kenya's MTIBA mobile wallets for healthcare savings. 3 million users scored 40% of cost reduction. Inversion can be useful as well to what? Making them as well more creative actions because reverse the problem. How to collapse the healthcare? What are like the actions? Defund rural clinics, ban generics, ignore community workers, and then so the inverted solutions work on in so and trying to neglect the existence of these elements that make so the healthcare collapse. We have a bit of lateral thinking. Another type of way to create solutions is so analyzing other elements and a bit of the nature so patterns to solve the type problem that we're stealing. So stealing from tech, logistics. Example, the Uber-style ambulance networks in Nigeria's GD Mobile. Another solution is blockchain drug tracking. Ghana's M pedigree stops counterfeit needs 90% of accuracy. And 3D printed prosthetics. The students not impossible labs cut costs from 10k to 100. Anti-fragility, so to thrive under stress, the interventions that we create. We have, for example, the solutions that Ukraine's mobile clinics operate during bombings and so treat more 1 million or more of war victims. And we have the Ebola firefighters. Guinea trained locals to trace outbreaks and so it stopped epidemics 10 times faster. Obviously, as any type of systems problem, we have to work on incentives. We have to design the incentives so to make the action that we deem to pretend the people to pretend to do. We have to create incentives and design incentives for people. So having a type of way to act that it will be ideal. For example, how to align motivation because we have a problem. Doctors avoid rural posts. rural type of population is important. But if the doctor avoid, what I have to do, probably I have to create design of the system that makes so the doctors have incentives to go for rural post. And then so what is solutions? For example, we have the debt forgiveness. So what is the debt forgiveness? USA Medics works 2 years in Appalachia, and then so what is created is 300% more rural coverage. Because US Medics works 2 years in Appalachia, they receive an incentive, can be a fiscal one. So with that, we can have as well have to get in count a bit of precautionary principles, so to avoid the reversal harm. And what's like solutions for that? Ban copycat drugs. So India halted 100 1.5 untested generics in 2023, and we have another thing that you can look so as well. So what's important to get is that you can use a lot of the models to take ideas from so your problems is what you want you to take and see. So hope by that you can already have a lot of solutions that already were implemented. So you see that a lot of people that work that are in these strong type positions, they adopt these methodologies so to create and solve problems. They use these methodologies, and then so if you want to get close to them in terms of quality, you can so make it by using these tools. So I expect these videos make you gain insights. I expect it was enough to make like the channel and subscribe. So I hope to see you in the next video.